Counting the dead. Measuring excess deaths is the best possible way to estimate the count of COVID-19 deaths. The real-time mortality impact of the COVID-19 pandemic is an important statistical measure to guide policy responses. But measuring the actual count is not an easy task. WHO in January 2021 had estimated, based on excess deaths data in Europe and the American continents, that actual deaths were at least 1.6 times over the official count. The problem of undercounting, even in mature public health systems across the developed world, is largely because patients who died due to cardiovascular issues, among others, even after apparent recovery from COVID-19, are sometimes not tracked and registered as COVID-19 related deaths. This is why, even in Kerala, with 100% registration of deaths and a relatively low case fatality rate, following criticism about the methodology to evaluate whether a death was related to COVID-19, the health administration in the districts, rather than a state level audit committee, will now audit deaths. But there is another class of undercounting across states, where health bulletins mislead by reporting a lower number of cases and deaths. This is the case with Bihar, where the reported toll was suddenly increased by 72% following a health department review after the Patna High Court found discrepancies in figures cited by different agencies in Buxar district. Bihar is among the states in India with the lowest civil registration of deaths, with barely 34.1% of the deaths being registered according to the Civil Registration System report of 2018. Estimations of the actual count of the death are difficult to obtain in the other states such as Uttar Pradesh as well, where public health systems are poor and neither the infections nor deaths have been effectively tracked, especially in rural areas where many have died outside of hospitals. One method to assess the actual number of deaths due to COVID-19 is by calculating the excess deaths during the given period when the pandemic has raged. Compared to the baseline mortality occurring in similar timeframes before the pandemic, this exercise also works best if death registrations are relatively high, which should be possible in most districts as registration of deaths has improved to 76% according to CRS 2018. Excess deaths analysis in Gujarat, Chennai, and Kolkata, based on collations of preliminary registration data by news organizations, suggest that they were nearly 10, 5, and 7 times higher, respectively, than reported fatalities during the second wave. If the CRS data sets maintained by the Office of the Registrar General and Census Commissioner of India, besides state registrars and municipal officials with a good quality of registration, are made available, it would enable better estimation of the actual mortality figures. In the meantime, only honest reporting of the deaths will help provide better mitigation strategies. Monsoon malady. Mumbai must urgently replace decrepit buildings to prevent houses collapsing in rain. The monsoon over the greater Mumbai region has come to be characterized by the unsettling annual spectacle of collapsing buildings, and this year is proving to be no different. An unsafe multi-storied building in a core area of the city has collapsed onto another, leaving at least 11 people dead and exposing one second. The decrepit base of dwellings in India's much romanticized economic powerhouse, the disaster has brought in its wake the familiar litany of accusations of people occupying unsafe and illegal buildings and civic authorities failing to act in time. Mumbai's Mayor Kishori Pednekar has responded to criticism with a helpless exhortation to the city administration to remove dangerous structures. Going beyond these predictable impulses, the overburdened city needs a time-bound and accountable system of ensuring the safety of its housing stock. Coinciding with this year's monsoon, the Maharashtra Housing and Area Development Authority identified 21 structures in Mumbai as being extremely dangerous, with an advisory to over 700 occupants to move to transit accommodation while reconstruction is undertaken. Understandably, the occupants are reluctant since the alternative housing is far away from their education and work locations. This is a conundrum that Maharashtra will have to address, treating it as a crisis that will be aggravated by changes to monsoon rainfall intensity over time. Coastal Maharashtra sits in the pathway of extreme monsoon weather events, which are forecast to increase in frequency due to ongoing warming of the Arabian Sea. Scientists, including those of the Indian Institute of Tropical Meteorology, have proposed, in the context of the deluge a few years ago, that accurate monsoon forecasting over central India, incorporating changes to sea surface temperature, would help governments prepare better to save lives and agriculture. For Mumbai, what this means is to accelerate its repair and rehabilitation program for weak structures and replace those that cannot be salvaged. The city desperately needs channels for huge volumes of water to flow out, and a plan to create new urban wetlands where feasible to store the precipitation. A rejuvenated Mithi River, its planned cleanup has been delayed by the COVID-19 crisis, could offer some relief, but more water bodies are needed, and will and it will take a mass housing program to make life safer for the thousands in hovels. A far-sighted plan to shift people from squalid buildings to modern ones is also a health imperative. Such a start must be made with the most tangible structures. It is also unseemly for political parties to use a disaster such as the one in Malad as a cudgel against the government, considering that Mumbai's civic base lies neglected over the decades regardless of who ruled.